Thank you for the warm welcome. What if the largest public health discovery of our time, and maybe of all time, was about the smallest of us? It's possible that from the first moment when the cells begin to divide and the body begins to specialize those cells into a beating heart, into the tiny skeletal structure, that experience has a powerful impact on who we become, how we know ourselves, and how we relate to one another. We live in a time where there's phenomenal discovery from neuroscience, from this study we've been mentioning today, the Adverse Childhood Experience Study, and from the field of resilience. And when we put these three fields together, we get some answers that I believe will build hope in this community and in every community across this country and around the world. I'm going to start by talking a little bit about the neurobiology, because if we understand how experience affects our bodies and our brains, we can understand a little bit better why adverse childhood experience has such a powerful effect. We've worked with one of the leading neuroscientists in the nation, Dr. Martin Teicher, who leads biopsychiatry and neurobiology research at Harvard and McLean Hospital, and he's helped us understand some things that I'm going to simplify with this slide, but trust me, he's reviewed all of the neurobiology in this set of slides, and it's pretty accurate, although it is simplified. So we all start with a relatively neutral start at conception, and all of us have brains that are adapting to experience. We're preparing for the world that our bodies believe we'll be living in. We prepare in ways that change the way our brain cells function, that change brain mass, and that change the way we interact with the world. We also prepare in ways that actually cause our genes to be expressed in different ways. So experience, it turns out, has a phenomenal impact on us throughout our lifetimes. And some people live in a dangerous world. And by dangerous world, I mean stress that happens that feels like danger or crisis, that makes our stress hormones and neurotransmitters elevate at high levels in our body for longer than 20 minutes at a time. Stress hormones like cortisol can actually be toxic to developing brain cells. So some people talk about this kind of stress as toxic stress, because stress hormones can actually kill developing cells, and it can also change the way they function. So if you live in a dangerous world, your brain will adapt to that world in very predictable ways. And what happens is individuals develop very predictable traits. They can use brawn over brain, right? They can be quick to anger and slow to soothe. They can be hypervigilant and hyperreactive and very focused and have a hard time shifting focus. Why would these adaptations make sense? Well, just think about it for a second. If you shift focus too much in a dangerous situation, you might take your eye off the danger, and then you wouldn't survive. So these adaptations, neuroscientists now understand, are adaptations that help the species to survive. If you live in a very safe world, you're also adapting to that experience, and your brain and body are learning how to be very relationship-oriented, very laid back, using process over power, taking time to discover all the different options before one chooses. And when I was in college, I was taught that the upper track was maladaptive and the lower track was adaptive. But now neuroscientists agree that's not true. Both tracks are adaptive. Both tracks are preparing the species to survive. And I don't know about you, I have a 30-year-old daughter, and when she was about 14, I was a little discouraged with her being on this bottom track because I wanted her to be able to react to danger quickly without thinking for so long. So both tracks have their disadvantages as well. Where we get into trouble is when there's a difference between how our bodies are hardwired to respond to stress and the world we're expected to live in. So if you're a child, for example, that grew up on the top track and you're expected to sit still, to use words to talk through every solution, to not react emotionally, but instead to stay calm through stressful situations, your body just simply doesn't respond that way to stress. And so it can be difficult for the child and for the adults around that child. And what we have to remember with this science is we become hardwired for the world we expect to live in. And our expectations physiologically are built on our childhood experience. So when I say it can be difficult for a child, I also mean it can be difficult for an adult. It can be difficult for a parent. These kinds of adaptations make parenting more difficult. Having a quick emotional reaction and difficulty soothing makes parenting harder. So some parents say, I don't know, parenting is just really hard for me. And what we need to understand is it could be hard because it is harder, neurobiologically. And that isn't about choice, it's about biology. These scientists teach us that there are three factors that determine the outcomes of experience. One is the kind of experience one has. The second is gender. Girls respond differently at different ages to various stressors. And the third is age, and I'm going to focus on age just for a moment. So I've talked about stress being hardwired into biology, and I just want to go over some of the ways that people change as a result of stress at different ages. By stress, remember, I mean our stress hormones and neurotransmitters go up to high levels in our body for 20 minutes or longer at a time, so that those chemicals become toxic to the developing brain. When there's stress prenatally, we see profound changes in both the mom and the baby. We see depression, which interrupts then the bond to the baby. We see attachment challenges, reduced brain mass with the baby, stress hormone dysregulation later in life, and relationship challenges. So when women are in danger during pregnancy, we set up a much more difficult parenting challenge. It's not only that we care about women and we want to protect them. If we care about the next generation, we will protect them. In early childhood, when children experience toxic stress, the limbic system is developing. And the limbic system you all know as your fight or flight response system. And there's two brain regions that are developing in the limbic system that make a really big difference throughout life. One is the amygdala, and the other is the hippocampus. So there's two. The amygdala tells your body, send out your stress hormones, get ready to fight, flight, or freeze, right? It shoots up the hormones so that we can respond in danger and keep ourselves safe. The hippocampus, I remember because it sounds like a hippo and they're kind of slow. The hippocampus calms us back down. It sends the message to the body, you can recycle those chemicals. You don't need them, you're out of danger. But when the amygdala and the hippocampus are dysregulated by toxic stress, you get some of these kinds of responses, like difficulty having emotional response where you respond really quickly, but you can't calm back down because the hippocampus isn't sending its messages properly. Or, for example, the amygdala gets really tired of doing its job, and stress happens and you don't respond at all. So emotional responses can be more difficult. Verbal memory, spatial memory, self-monitoring, self-awareness, motivation, all of these things can be profoundly affected by toxic stress in the earliest years. We all know that the earliest years we're building the foundation of brain cells and functioning that we will live with the rest of our lives. So the early years are so important, but they're not the only sensitive developmental period for brain regions to be profoundly affected by toxic stress. Middle childhood, that period of time between about 7 and 10, also is a very sensitive period of time for effects to the corpus callosum, the superhighway that connects the right and left side of the brain and helps us do things like make meaning from symbols like letters and numbers, integrate math and language, have an artistic response or a creative response while we're in a rational conversation. Most of our complex thought is we need our corpus callosum to work well, that superhighway to work well in order to engage in it. So protecting children at that age of 7 to 10, so critical. It's also important to note that the corpus callosum is profoundly affected by neglect for boys in the early years and by sexual assault of girls in the middle years, that's 7 to 9. It's an example of where girls and boys respond differently, still the same brain region, very important for development. So let's not just choose one age. Let's make sure we protect children throughout childhood. And finally, in that period of time, just pre-puberty and into adolescence, a couple of really important things are developing. One is the cerebellar vermis, which we now know to be the seat of mental health. Effects of the cerebellar vermis are associated with schizophrenia, with bipolar disorder, with profound depression, with multiple personality disorder, and I could go on and on. And so when we fail to protect our children in the pre-puberty years and into puberty, we are jeopardizing their mental health. It's as simple as that. And one thing that we should also know about these sensitive developmental periods is that in early childhood, the hippocampus, and in pre-puberty, the cerebellar vermis, we're born with these baby granule cells in those two parts of the brain that are programmed to blossom in adolescence. So you might hear people say there are 2 times when the brain is developing its mass, early childhood and in adolescence. That's true. The adolescent brain mass development happens because those granule cells are programmed to blossom at that time. But here's the trick. Toxic stress in early childhood and just before puberty can kill those granule cells. And we don't see the reaction of the body for 7 to 9 years. So there can be a delay in really seeing the symptoms coming from toxic stress because we don't actually see the effect until the brain fails to make this blossom, this blooming of its capacity later on. So let's make sure when we notice that a family is struggling that we don't just watch for a year and help for a year, because new kinds of challenges can come up later on in childhood. And so we as a community can provide supports throughout that period of time. I'm going to switch gears now from neuroscience, which is about individuals and how individual brains respond to toxic stress, to a completely different kind of study. It's an epidemiological study. It's about the population as a whole and the health of the population as a whole. And we're not used to really thinking in those terms. We're used to looking at research in terms of individuals. But epidemiological work is so important if we want to shift the health of a whole community. If we want to shift the health of all of Thurston County, we need to pay attention to epidemiology. So I'm going to talk about the ACE study. You all knew that before you came. And I'd like to say that most people, when they hear they're going to hear about a story about the ACE study, they think it's going to be all about the magnitude of the problem. But I'm all about the magnitude of the solution. Because what's predictable is preventable. When we understand the dynamics of how these challenges unfold in lives, we can make a change in the community that will have a profound effect on the health of ourselves, our neighbors, our children, our grandchildren, and for every generation that will come. So the ACE study, it's the largest epidemiological study of its kind. There were over 17,000 participants. It was a partnership between the Centers for Disease Control and Prevention in Atlanta, Georgia, and Kaiser Permanente in San Diego, California. These 17,000 individuals had Kaiser Permanente insurance, so that should tell you something. Employed, insured, San Diego, one of the wealthiest counties in the country. And so they asked these individuals, would you let us know about your childhood experiences? Yeah, they asked them 70 questions, along with the regular intake for health. And then those 17,000 participants also said, you can have access to my health records for the rest of my life. So it's an ongoing study. We're continuing to learn every month. There are new papers from the ACE study. At the time of the ACE study, really all of the research that was being done about improving health was about the 3 top parts of this pyramid. In fact, Dr. Ando had won national and international awards for his work developing the surveillance health system for our country, and then went into being on the team who developed the country's strategy for reducing heart disease. But it bothered him as he did that work because he said, risk for heart disease isn't random. Something has to be driving this risk. What is it? And it bothered him through his years when he was working on heart disease prevention. He said, if risk isn't random, something has to be driving it. So he developed, along with Dr. Vince Folletti, the other co-principal investigator of the study, this model. It goes from conception to death. It's a life course model. And their theory was that adverse childhood experiences lead to social, emotional, and cognitive changes, which lead to risks, which lead to disease, disability, social problems, and early death. They studied 10 different categories of adverse childhood experience, and they're listed here. There are 5 categories of abuse and neglect, and there are 5 indicators of family dysfunction. Having a mentally ill, depressed, or suicidal person in your home, having a drug-addicted or alcoholic family member, parental discord as indicated by divorce, separation, or abandonment, witnessing violence against one's mother, and incarceration of a family member. And most people, when they read this list, they say, are these the only ACEs? What about being bullied? What about witnessing violence in one's neighborhood? And the neurobiology teaches us there are other ACEs, right? Because it's about those stress chemicals going up and staying up for long periods of time. But what's remarkable about the adverse childhood experience study is it gives us a measure of the toxic stress dose throughout childhood. It's like when you go to the doctor and they have you step on the scale and they take your blood pressure and they take your temperature. Those are indicators, they're little measures of your overall health. The ACE study is a reliable measure of the overall health of our population. It is a phenomenal finding that we can all use to really make a huge difference. They found that ACEs rarely come in ones. Almost always, there's more than one if there's one. In fact, 87% of the people who had one ACE have at least one more. And so they made a simple score from 1 to 10. For each ACE category counts as a point. If you had all of these categories, you would have a score of 10. So we decided we would actually measure ACEs in the Washington population, and the data I'm going to show you is from Washington. And we were unable to study neglect because the CDC has a very rigorous testing process for their questions, and the neglect questions didn't make it through their testing process. So the ACE scores I'm going to show you go from 1 to 8 because they don't include neglect. So 62% of the adult population has at least one. 26%, 1 out of 4, has at least 3 ACEs, and 5% have 6 or more. The most important finding from the ACE study is ACEs are common. In any room, there are many of us with 3 or more ACEs, and there are many of us with 6 or more. The second most important finding is that ACEs appear to be causal. They meet all 9 tests in epidemiology for inferring cause, and one of those tests is the dose-response relationship. So the idea here is that the higher the ACE score, the higher the probability or the odds that that group of people will have a disease or condition that we're looking at. So let's look at some of those. ACEs drive risk for disease. I'm going to walk you through one of these charts, and once you've understood how to read one, you'll understand how to read them all. They're all laid out the same way. And really what I'm asking you to do is look at the shape. You don't have to know all the numbers to really get the point here. We're looking at the stair-step shape, which starts lower and leads to higher. Along the bottom are the ACE scores. So the first bar are people who said they had 0 ACEs, people who said they had 1, 2, 3, 4 or 5, 6, 7 or 8. And on the vertical axis, we see the percentage of people, in this case, who were currently smoking in 2009. So among people with 0 ACEs, 10% were smoking, and among people with 6, 7, or 8 ACEs, almost 30%. And this is after our state spent some of the largest investments in preventing smoking and in helping people to stop. We were a state who had a huge tobacco settlement because then Attorney General Gregoire was on the settlement committee. So she made sure that lots of dollars came into our state. So why would people continue to smoke? How does it feel to have 6, 7, or 8 ACEs? Well, one of the things that can happen is anxiety. And nicotine in particular, is a very powerful anti-anxiety. So when we talk to people about their responses in life, instead of thinking, what's wrong with that person? They're choosing to smoke when we all know how dangerous it is. Let's think, what happened in that person's life? And is there another kind of accommodation that could cause less harm in their health? We see that same dose-response relationship with people having had a drug problem, going from 1% among people with 0 ACEs to 12% among people with 5 or more. And if I showed you charts for each and every one of these problems, you would see the same stair-stepped pattern. And here we have chronic disease. Again, I've showed you only 2 charts because of time, but we see this same dose-response relationship with cardiovascular disease, with asthma, and actually asthma is one of the consequences from ACEs that we see quite young. Elementary age kids in studies that were done by Dr. Chris Blodgett at Washington State University show asthma related to ACE scores as early as 3rd grade. ACEs also are driving mental health in our society. You can see the same dose-response relationship with anxiety, with needing treatment for a mental health condition, and I could show you all of these charts. I will say that there are 2 conditions that ACEs are most powerful in affecting. One is attempted suicide. Almost all attempted suicides are attributable to ACEs. And the other is IV drug use. Virtually no one takes a needle and shoots up a drug that doesn't have a significant amount of adverse childhood experience in their lifetime. And for those of you that are business leaders in the community, ACEs are also driving productivity challenges. This first one is work-related injury or illness, goes from 3.6% to over 10% based on the ACE scores, and then missing 10 or more work days in a month. I don't know about you, but it would be unheard of for me to miss 10 work days in a month. I love my work. Look what I get to do. But beyond that, that's a lot of days to be unable to arrive at work and do your work. But people with higher ACE scores, we see 20% of them missing work 10 or more days. We wanted to know, we know what the prevalence or the percentage of adults that have 3 or more ACEs. What about our teenagers in Washington? So we did I didn't do it, I'm not a statistician. My colleague did a statistical analysis making a bridge between the Healthy Youth Survey and our adult survey where we had counted ACEs. And this is an estimate of what we see among 10th graders in an average high school classroom. So remember, 26% of adults in Washington have 3 or more ACEs. 42% of 10th graders have 3 or more ACEs. 26% of adults have 3 or more ACEs. 42% of 10th graders. So if we hear teachers saying, I've never seen this is a lot harder than what I used to have in my classroom, it could be because it is a lot harder. If we hear teenagers saying, I don't know why you think life is easy to navigate, it is tough for me, it could be because they're actually carrying a heavier burden. And these teenagers, these 10th graders, are the next parents, right? Some of them already are parents. So the support we give to them is absolutely vital to the health of the next generation of children. And when we look at just Thurston County, this is estimated because we just had 2 years of data when we made this map. We now have 3 years, and we're scrambling to try to get you better data for Thurston County based on the 3 years. But these darker areas on the map, the dark orange, are places with the highest ACE prevalence in the state, the highest percentage of adults with high ACE scores. And you can see Thurston County clustered with other counties at that high tier. And in Thurston County, it appears from the data we have so far that there are geographic areas in the county where families really could use more help and support. And interestingly enough, many of those areas are places where we don't have public transportation, where we don't have our concentration of family support services. So we really need to think strategically about where we're helping families, as well as how we help families. This is a long list, and I don't expect you to digest it all at once. You can get a copy of these slides through the Junior League if you'd like to really take some time. But the point is that there are many, many outcomes that ACEs are actually the driver of. And why I think that's important isn't just because we care about diseases and risk factors and mental health and general problems like homelessness and injury and life dissatisfaction, but it's also because people with higher ACE scores are more likely to have a mental illness, to have a drug or alcohol problem, to be divorced, to be incarcerated, and to be either a perpetrator or a victim of intimate partner violence. You remember the 5 ACEs that were about household dysfunction? These are the 5. They become ACEs for the next generation. In fact, we can see in our data that people parenting adults in Washington that have high ACE scores are 14 times more likely than people with low ACE scores to pass 2 or more of these household dysfunction ACEs on. And that's even when they're very successful at preventing child abuse and neglect. So one of the myths we have to get out of our mind is that parents are monsters that are choosing to harm people. Parents are loving adults that have a tough challenge. That's a really different way to think about this dynamic, and it's a way that can take us a lot farther. So I want to talk about high leverage solutions. I really am in favor of a 2-generation strategy where we help the adults who are parenting that have very high ACE scores. We help them in ways where the effects of their ACEs are not as pronounced. And in particular, I'm interested in reducing depression, anxiety, anger, difficulty with emotional regulation, because those are things that if you get better, your parenting will be easier, right? So we want to moderate ACE effects in ways that help parents prevent ACEs in the next generation. As we help adults to prevent ACEs, there will be fewer ACEs. There's a little ACE score there. There's their ACE scores. And as there are fewer ACEs, we'll have less ACE effects. So here we have this mutually reinforcing investment that can take us very far. We think in child abuse and neglect about breaking the cycle, but I want us to think about making this cycle. And it's possible. Here's another way to think about mutually reinforcing strategies. We can improve the quality and quantity, if we can afford it, of services, of direct services that help people in times of need. But we can also build the capacity of the community to create healthy environments for families and to create just neighbor-to-neighbor helping systems that are profoundly important in people's lives. And as we do these 2 strategies together, we get this same mutually reinforcing positive effect. So I'm going to talk for a minute about resilience, and then I'm going to close. All of us want resilience to be the answer. And certainly, we are really invested in moderating ACE effects. And the resilience literature isn't quite as developed as some of this literature I've just been talking about neuroscience and about ACEs. But there's a wealth of knowledge there. And I also want to say there's a wealth of knowledge here, because all of us have weathered difficult storms in our lives, and all of us can take a moment to reflect on what really helped. Some of the things I think will come up for you are, I had some people that were emotionally supportive. I had some social connections. There were some folks I could count on for practical help. These are examples of resilience factors that make a big difference in family life and help to prevent child abuse and neglect. The resilience scientists talk about driving 3 main systems in order to improve resilience. One is individuals' capabilities and family capabilities as well. And most of our social service and health systems are set up to address capabilities. Our education system certainly set up to build capabilities. But one caution I want to give you is that for some people, ACEs affect their capabilities. So when you just read in the literature the list of resilience factors, for example, if you can read well by 3rd grade, you'll do better. If you have a loving parent, you'll do better. Well, if you suffered severe neglect and you didn't have a loving parent, you might not read well by 3rd grade, but you might have some other amazing core gifts that are your gifts that you brought to earth to share with us as a society. So can we all watch for each person's core gifts and help them to develop? If we think about capabilities in that way, instead of thinking about it as a certain set list, I think we'll go a lot farther. The second system is attachment and belonging, and it's never too late to attach, and it's never too late to belong. And one of the disturbing trends we see in the data in Washington is this trend that kids who end up in juvenile court in lockdown facilities, they started being, that have high ACEs. Kids who end up in lockdown facilities generally have much higher ACEs, as our prosecutor eloquently reminded us. But those with high ACEs above 4 started being suspended or expelled from school in 2nd grade. So if you're not safe at home and you're not safe or welcome at school, should we be surprised where you would end up? Because we don't have another system. The court is the other system. So that's one of the community challenges, is to figure out how do we enhance belonging in other places other than court. We don't need to rely on that system. We can build other infrastructures. And then the third system we need to build is community, culture, and spirituality. And that is perhaps the most powerful arena, because all of us are affected by the community in which we live. We affect the community, and the community affects us. So we can essentially sweep families along in healthy traditions, rituals, practices, in ways of engaging like tonight, in learning together, in support networks. So I just wanted to say quickly some things that help with belonging. Engaging in multiple family or whole community dialogues, which Thurston County has done quite a bit of investment in. It's a powerful strategy. Developing rituals, celebrating success together, including a wide variety of therapeutic environments, including environments where friendship is therapeutic. Setting up mutual support systems, then art, movement, rhythm, music, and learning. And what helps with community? These kinds of gatherings, creating opportunities for everyone to contribute. We think of leaders as anyone who wants to help. Let's make niche roles for everyone who wants to help, even if they only have a small amount of energy every month. Learning together, creating reciprocity. In our surveys in our state, whether it's children or adults, what we hear is, we don't like to ask for help. We like to give help. So let's open up more space to give help. And then we all need to act from the future we want to live in. Let's not act out of the past. The future is where we're headed, and our actions will bring us there if we start to behave in ways that are consistent. So remember, I said we want to moderate the effects of ACEs on parents, and we want to prevent ACEs in the next generation. So I'm going to leave you with a couple slides to give you some hope. We're doing it in Washington State. First of all, communities that have higher levels of those 4 things, leadership, learning, coming together to see the truth clearly, and operating from the future, right? Using the results that we want. They're much more successful at reducing the symptoms of mental illness. So the blue bar are high capacity communities that do those 4 things well. The red bar are communities that score lower in those areas. And this first area is serious mental illness, the second severe depression, and the third depression. See the drops: less mental illness symptoms, less severe depression symptoms, less depression. Those translate into easier parenting. And then, what do we really want? We want fewer ACEs in the next generation, right? So this tells us these are communities not intentionally building those 4 capacities, communities that are building them, but they're at the beginning stages, communities that have been at it for a while, and communities that are the most effective at these 4 things: leadership, coming together, learning, and fostering this sense of shared identity and future. And we see the percentage of young adults with high ACE scores coming down based on how much capacity has been built. So why are ACEs really the high leverage focus? Why would we consider them being a shared action agenda? Well, here's the answer. Epidemiologists can calculate the amount of a disease or condition that is attributable or caused by a disease agent. So they can, for example, they can calculate the amount of lung cancer that's attributable to smoking. That's an example. And this is a chart of those population attributable risk for these conditions. Needing treatment for mental health condition, 42.7% of needing treatment for a mental health condition is attributable to ACEs. 55.7% of anxiety, almost 60% of high-risk behaviors for HIV, 21% of heavy daily drinking, 25.5%, I think that says, cardiovascular disease, 24% of cancer, 32% of separation, and you can read all the way along. So a shared focus on ACEs mean we no longer have to address these problems one at a time. If we thread this science through what we are already doing, we don't have to change what we're doing, we just have to inform what we're doing using this neuroscience, this resilience, and the ACE study. It's like putting a sponge into the middle of this wheel. We reduce all of these conditions and more at once. That's what we mean by the magnitude of the solution. Thank you.